Good evening, Dr. Keerthika Garu.
Good evening.
Today we would like to know your entrepreneurial journey, how you became this big diagnostic center, radiologist and all. Your story, we want to know about that and we want to inspire ourselves. So please let us know.
First of all, thank you very much for giving this opportunity. So I heard that, I came to know across this Junior Chamber International. So I was very happy to be part of this program. Thank you so much for having time with us. So let me start off the story with to tell truth, I'm living a dream which is dreamt by my husband, really. Because though I am the person who is showing off the face to this institute, but my husband has actually dreamt that we should not be small. We have to grow up. We have to do more inspiring things, and we need to serve the society for the betterment of the mankind, something like that. So that is how we started. Previously, I was more of to the grounded person. It's okay if we start off. If I have a happy family life, or I'm doing well with my job and all. So my life was going on very happily. So I thought this is all okay for me, because we were just married some 3 years ago. So we thought that was the only life. We were very much happy together. But then my husband used to tell that there was so much of things which I have achieved. When I was a student, so I have been very meritorious. So I have achieved lot of laurels. I have stood state first, or I have gained so many awards, excellence awards and all. So he told me this is not, you should not be standing like this in this way. So you should be you should be known by everyone, and the society needs your services, because you would be doing it more better. So that is how we started with a small idea. We can start with our own setup. Though initially we were totally out of funds, we actually did it everything on our own. The hospital, the clinic, whatever is standing right now. So it is on the hard earnings of ourselves. So for the 3 years we have been dreaming of something to start off like this, and it all started 3 years ago.
Actually, we started this in 2020 February. As soon as we started, we were the COVID came.
Yeah, because we were welcomed by a lukewarm response. We have got the COVID.
Few of our employees thought that we'll be closing it after COVID. We will not be in a position to open it after COVID. But we started proper healthcare to everyone. Few people will be saying, few of our patients will be saying, sir, even though you are only diagnostic services, please give us treatment also. Means they are getting so much pleased with our service. So we started with that motto, so that the patient should get utmost satisfaction with the care we are providing.
Yes, that is what we have noticed. Even though we are the doctors, we used to visit hospitals and all. So the doctors are really too busy to answer our questions, or to hear our stories patiently. So even we are also faced by such kind of things. We thought that this should not happen at our center. So we we must be patient enough to listen to their problems, and we should give. They'll be very happy if we give our hearing ears.
Yes.
They don't expect too much of things. They don't expect everything should happen, miracles overnight. But if
So
we
if
can
we give them the time,
yeah,
some
they're
15 to
more
20
pleased.
minutes per patient, it's more than happiness for them, because they'll feel that their disease is somewhat cured here.
Yes, yes.
So we started with this motto, and we started with a small center, with a small only ultrasound center. Then we started growing it with her support, constant support. She will be looking after the center from morning to evening, and she will be ever smiling, always smiling with every patient. Never she will get irritated or anything like that. And yeah, as she said, she received many excellence awards in her childhood, and she met Abdul Kalam twice. Actually, what is the instance is, Abdul Kalam is very interested to talk to her, so he used to call her. He called her to Rashtrapati Bhavan for a lunch, and whenever he comes to SARC for
Yeah, because
Nellore.
Shar is I'm a resident of Nellore, so Shar is very close by. So as he visits on and off, he visits like sometimes. So then I used to get opportunity to meet him. That is what I mean. We should always actually attribute to his greatness,
Yes.
because such a visionary, such a great president, but is beloved by so many. He's like very grounded to meet such ordinary people because he loves children so much. So maybe that is why, because no other president had given so much of his time to meet young children. But we are like really very much inspired. He is like a true visionary who feels that because children are the young minds who can ignite the next India or the young India. So that is why maybe the opportunity has come that way. So we all
She
started.
got motivated from that, and
Yeah.
she, all the exams, whatever exam you keep, she will be the first. Even in PG, UG, everywhere she used to be the first. After marriage, we both of are working. We are working at different places, and I said that your talent should not get wasted. It should be known to, as in your childhood you are known to many, as you are the first student. You used to crack any exam first. So in the same way, if we start our own business or if we start our own setup, it will be a role model for everyone. So we should not be like this, and we started the journey like this.
Actually, as you told, I'm not new to interviews or whatsoever, because right from 7th class, so whenever we have some district common examinations and all, so always I used to get interviews. I used to be flocked by people who used to take my photographs. I used to get like that. So I'm used to that attention. But then slowly, as we move on, so one day, we feel that we have crossed all over that. So we have come to working, we are doing well. So that is what is, but it should not happen like that. So that is why we are doing well. But
Initially
he's one good thing about us, he never gets satisfied. He's very ambitious. So he says that we should not stop anywhere. Anything should be only a comma, but we should never stop. So he feels that some goal has been we have achieved. We have when we used to have ultrasound center, he used to tell we need to set up CT. So once we have gone through that, he says that we need to take, we started OBG. But after second, he says that we have to set up a new goal. If he doesn't have goals, his brain, it doesn't work actually. So he feels very restless. So he says that, okay, we need to have something. So partially actually, right now I'm busy with my kids, enjoying doing well with her and all. So whenever he's having a big dream that to which I'm also part of it. So I'm actually living his dream. True third.
For 3 members, we two and one receptionist. That's all. No one else. And now we are providing employment to some 25 members. With all of them will be very happy with us, happy to work with us, and the patients whoever diagnosed with from us are very happy.
Yes. But I feel this setting up a center should not be a big thing to some of our seniors or whoever also. They have set up their own centers too. But then we feel very proud of our center because this is all we did it on our own. CT having everything is a very big investment. But we whatever penny has been sent, there has been not much support from the parents and all. We have got everything on our own. They are too busy with their own commitments and all. So they used to ask us to wait for some time so that we can do something for you. But he doesn't listen. We will not be able to wait because time doesn't wait for anyone. So we'll have to start somewhere. Somewhere I'm happy that because he has started. So that is why maybe right now you have come to us. But suppose we have been there working somewhere, maybe we should have never met.
Yes.
So it is a good thing that we have to start, we have to move, we have to grow. It is always there. We wish to do fetal medicine, do many other things. We have to improve on, collaborate with other services and improvise, start up new branches and all. We have lots of things in our dreams, but we are making the small steps towards our dreams.
Yes. So as we have heard about your journey, it was really very good. As you said, it is very inspiring to us that every set of time you set a goal to achieve that, and then after achieving that you never stopped. You again set another goal and you did that. And even you had a very small kid, that even though you have set up your goals and you never stopped, you never hesitated for any hurdles at all. So this is really a good thing, and we want a small suggestion or any advice from your side to the youth who are outside, who are ready to do something, who wants to build their career but they don't know how to do it. So any small advice from your side would be
Yes.
For anything, for starting any idea or anything, follow the idea which you get and follow the idea. Don't fall in the trap of money. Earning money should be a byproduct of whatever idea you get. Follow the idea. The money will be a byproduct if you follow the dream. That's the small advice I can give.
very nice.
Any difficulties you face?
The most, I mean, for me, we had a very happy family life, so we support each other very well. So when there are no other problems, issues at home, so any problem which we face is financial difficulties. So the constraints are like so difficult that we always think like, oh, why did we start out in the first place? First of all, like whenever we run short of money, that is the only
Because,
moment like we feel
the
very low.
radiology or the setup which we are in requires lot of capital.
Yes. Because other branches and all, it is okay, clinical branches, if you have got, some kind of basic setup also, it will go on. But in radiology, that would not
We
happen.
need to upgrade our machinery every now and
Yes.
then. Not only the machinery, we need to upgrade the facilities provided to the patient, because nowadays patients are asking for more facilities.
Yeah, they
Rather
expect a
than-
lot from a
rather than the
diagnostic center,
treatment,
actually.
They are asking for facilities also, so we need to upgrade them regularly.
So sorry to ask this, but you ever any time regretted why I started this?
These are part and parcel. We will get that feeling also.
Yes.
The next moment will get, if one patient and says, sir, I came because one of my friends said me that you do the scan nice. So we forget all this and come.
Actually,
Again, our energy grows up.
Yes. The truth is that we get a lot of investment.
Yes.
But then we were not into it. But most of the patients who come, they come most with the mouth of whatever, with the goodwill they come up. So that is really like very much gratifying. We feel like very satisfied when somebody comes like they get sweets, they talk to patients like my baby was healthy, so I have come XYZ. Even though the doctor suggests for some other place also, they come up. So that makes like I think
That
good,
motivates us.
Yes, that is true. That is the only the fire or the spirit which like keeps us like.
So even though you have those financial crisis and all, we heard that you are doing a service in your area within Madhurawada. You do always that.
Vijayanagaram.
Services
Yeah,
at
Vijayanagaram. Every Thursday I do scans for pregnant ladies, and mostly ladies. We do for everyone. Pregnant ladies, we do it for free at Sri Sai Sathya Sai Super Specialty Hospital in Vijayanagaram. We do it for free.
It was actually
Every week.
collaboration here.
Yeah,
Every
every
week.
week. It's not
That's fair.
my part. It started by a doctor who treated me when I had an injury in my childhood. He started it and he asked me to continue. Means
So
start
needed
the
like
scan
radiology
services.
services.
Radiology
So that
services.
is
He asked
why.
me to start. So I welcomed it and we are continuing it from past 4 years.
So one grateful act actually triggers one more. So like my husband was very much grateful that he got treated with a doctor, which in turn actually motivated to do one more act.
You are also doing a service.
I think it's like really difficult.
yes.
They are like growing up and we had to meet their
Oh, yeah,
demands
redneck
with
kids.
us.
Thank you.
See, because to be frank, all doctors depend on radiology department. That's the reason
Actually, my son thinking the same.
Very smart.
He got sick.